Hi, my name is Kahyan, and the subject that I will be talking about is schizophrenia and drug use. So I'll start by doing an introduction. So the definition of the disease is, quote, schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Quote. So I will now be answering 3 questions to give a bigger understanding of the illness. So how does someone get schizophrenia? The precise causes of schizophrenia are unknown, but the theory based upon research described that the causes of schizophrenia as a mix of genetics, physical, mental, and emotional factors that will make a person be more likely to develop the illness. What are the main symptoms? The main symptoms are delusion, which is problem recognizing reality, hallucinations, which is seeing things that aren't real, disorganized thinking and speech, abnormal or disorganized motor behavior, and negative symptoms like lack of emotion or lack of personal hygiene. So I will be mentioning during the presentation positive and negative symptoms. So I inserted here a table which gives you the basic positive and negative symptoms of schizophrenia. So next question, is it curable? You can get cured from schizophrenia, but there is therapies and drugs that act in a way where one can get a lot better over time, reducing episodes and alleviating the symptoms of the illness. So next, a little bit of history. So schizophrenia means split mind in English. Patients who suffer from it experience trouble when it comes to identifying what is real. They will often hear voices or see things that are not actually there. The disease was first identified as a distinct illness in the 1880s by Kraepelin and was before seen as another form of psychosis. Also, prior to individual actually studying the illness, people related schizophrenia to madness, often thinking patients suffering from it were possessed by demons. So we can see this term actually was used by Sachs when she says, "My journey through madness." When it was identified as an illness, treatments for it were to induce a fever to patients, gas therapy, electroshock therapy, and the removal of the part of the brain that creates intense emotions. But these treatments were actually meant to eliminate the abnormal behavior created by the illness and were not meant to actually take away the pain or cure it, even if we now know that the disease is not curable. And it is finally in the 1950s, so recently, that an antipsychotic drug was created. So my research. My research is going to be based on schizophrenia, more precisely, why do people affected by the illness use drugs? In other words, what motivates them to consume substances, and the consequences related to this consumption. So my research question is, what influences and motivates schizophrenics to consume drugs, and what are the consequences? And my thesis statement is, patients will consume drugs as a self-medication process in order to cope with the antipsychotic drug they are prescribed. So just to start off by mentioning, that up to 50% of patients with schizophrenia exhibit either alcohol or illicit drug dependence, and more than 70% are nicotine dependent. I will later talk about why the nicotine percentage is so high. So through my research, I found that most people who will use drugs while suffering from schizophrenia will do so in order to try and cure themselves. This is called the self-medication hypothesis. Drugs are primarily used in order to deal with the negative symptoms that we saw on the table before, such as social isolation and dysphoria, which is a feeling of dissatisfaction with life, which basically comes from the antipsychotic medication that are given to the patients. Researchers found that nicotine could reverse some symptoms, like complex memory, which is the medical term for short memory. And this is why a lot of patients will be prone to develop a dependence on nicotine. So the researchers came to a conclusion that, quote, nicotine cessation is very highly supported in health prevention programs worldwide. However, according to careful interpretation of the results reported by Adler, which is the name of the researcher, nicotine improves cognitive performance in schizophrenic patients. But even if schizophrenics use drugs to alleviate the symptoms of using the antipsychotic drug, it is actually more common for alcohol abusers to have heavy hallucinations and delusions. Another role that drug plays in schizophrenia that I think is worth mentioning, even if it's a little off topic, is that it can actually contribute to somebody developing the illness. Like I mentioned before, schizophrenia is in most cases developed in one's teenage years. Quote, Chambers, which is the name of this researcher again, emphasizes that adolescence is a critical period for the neurodevelopment of brain regions associated with impulsivity, motivation, and addiction. Quote, so interfering with the changes occurring in the brain can be a major factor in whether one will be suffering from the illness or not. So basically, drugs can be used to alleviate symptoms of schizophrenia or can also be a factor in developing. I found a good example to support this, so I will quote it right now. Quote, in a recent study, Weiser, name of the researcher, investigated a sample of more than 14,000 adolescents followed over a period of 4 to 16 years and found that adolescents who smoked more than 10 cigarettes per day at initial evaluation were significantly more likely to be hospitalized for schizophrenia during the follow-up period. Thus, either smoking might be used as a self-medication of symptoms or abnormalities in nicotinic transmission might be involved in the pathophysiology of schizophrenia. Quote, so basically this means that they did a research on adolescents that smoked a lot, and it is proven that they have higher chances of being hospitalized for schizophrenia. So basically, either they use cigarettes as a way of coping and alleviating some symptoms, or it was actually a factor that played a major role in them being hospitalized. So then I did some research on schizophrenia related to cannabis and schizophrenia related to cocaine. So, for cannabis, there's a theory that scientists have looked further into and came to the conclusion that yes, cannabis can increase risk of schizophrenia and psychosis, but it isn't a factor that plays a major role in the development of the disease. Quote, overall, cannabis does not seem to represent a sufficient cause for the development of schizophrenia. However, even though the majority of young people who use cannabis in adolescence do so without experiencing a harmful outcome, there are consistent findings that cannabis use does indeed increase the risk for schizophrenia and other psychotic disorders in vulnerable people. Quote. But when it comes to cocaine, the consequences are a lot more serious. Patients will mainly use cocaine because it helps their motor system, which is weakened by the antipsychotic drug, which we saw previously. The consequences of cocaine abuse in schizophrenics can lead to heavy chances of committing suicide and a higher hospitalization rate. So basically, in conclusion, schizophrenia and drug use are closely related. Patients who suffer from schizophrenia are more vulnerable in drug misuse, mainly because of the fact that the antipsychotic drug misuse will create side effects that the patients will try to self-medicate by using drugs. So this use of drug, like I mentioned, is primarily to alleviate the symptoms, but there's another aspect that we saw, that it can actually be a cause of somebody being hospitalized by the illness. So on a more positive note, researchers are well aware of this close relationship between schizophrenia and drug use, and they have developed cognitive therapy to help patients cope with the side effects of the antipsychotic drug. But they also develop new drugs which have less side effects, in which it's easier for patients to cope with the drug that they are prescribed. So thank you.